Hi everyone, this is a short video about type 2 diabetes. Diabetes is complex, so we will attempt to simplify the details to help you learn more about this condition.
What is diabetes? Diabetes is a condition where there are high levels of sugar in your blood. Insulin is a hormone that controls the level of sugar or glucose in your body. Your pancreas is an organ located behind the stomach that makes insulin.
In type 2 diabetes, your pancreas makes insulin, but your body cannot respond to it. Around 1 in 10 people in the United States have diabetes, primarily type 2. You may not always feel symptoms with this disease, but when glucose is higher, it may increase your risk of heart disease, kidney disease, and stroke. Diabetes can cause various complications like numbness in your feet, vision changes, and kidney disease. However, we have medications and treatment to help.
Type 2 diabetes is caused by many different factors and does not always depend on how much sugar you eat. You may be at higher risk of diabetes if you have a higher body weight, are older than 45, have a family member with diabetes, or limited physical activity. Having prediabetes does not mean that you have diabetes, but shows that your blood glucose levels are higher than normal.
You can prevent the progression from prediabetes to diabetes by losing 7% of your body weight, increasing your physical activity to over 150 minutes a week, and limiting calorie intake to 1,200 to 1,800 kilocalories per day. Your doctor or pharmacist may recommend a drug called metformin if you match certain criteria. However, having good lifestyle habits is the gold standard of treatment for people living with prediabetes.
An A1C is one of the tests that measures the amount of glucose in your blood. Your goal A1C will usually be less than 7%, but can vary depending on what your provider tells you. Goal levels for many people when they're not eating are between 80 to 130 milligrams per deciliter, and levels 2 hours after a meal are less than 180 milligrams per deciliter.
You may have episodes of low blood sugar or hypoglycemia. Hypoglycemia is usually a glucose level of under 70 milligrams per deciliter, or glucose readings when you feel symptoms of low blood sugar, such as shaking, sweating, or increased hunger. Our aim is to have hypoglycemia as little as possible.
Medications for diabetes includes Fortamet, Jardiance, Ozempic, Januvia, and Actos. You may also be recommended insulin or be instructed to monitor your blood sugar daily, but not all the time. You may receive 1, 2, or more of these medications to take at the same time. All these medications will work in different areas of your body to help decrease your blood sugar. Some of these medications can protect your heart, kidney, and help you lose weight, but not all of them. Depending on what medications you're on, you may need to check your blood sugar levels at different times of the day. Talk to your pharmacist or provider so that you know how to take these medications, what they are for, and what to expect.
It's important to take these medications every day, even if your blood glucose and A1C are at goal values. That means that the medication is working. Taking your medications is key to achieving good diabetes control. Before you run out of medication, make sure to get more at your pharmacy. If you are out of refills for the medicine, let us know or call your doctor. The main takeaway is, work on finding a treatment plan that works for you and stick to it. Having good adherence is one of the keys to having great diabetes control.
Making changes to your lifestyle is as important as taking your medication. To better treat your diabetes and reduce your risk of getting heart disease, you should aim to increase physical activity to at least 150 minutes per week of moderate intensity exercise. This can include brisk walking, hiking, or swimming. Aim to lose 10% of your total weight with an initial goal of 5%. To lose weight, it is important to reduce calorie intake, around 500 to 700 kcal per day. You should also stop smoking, something that can be helped with, and have a good sleep and mental health. Lifestyle changes may sound difficult, but alteration to your daily habits do not need to be drastic. If you're having trouble achieving this goal, have a conversation with diabetes management team at Dawn.
Though you may have heard of a diabetes diet, it doesn't really exist. There is no one-fits-all regimen. However, you should focus on eating carbohydrates that are high in fiber, like whole grains, maximizing non-starchy vegetables, like leafy greens, and limiting alcohol intake, which is less than 2 drinks a day for men and less than 1 drink a day for women. Also, try choosing water or adding flavor to your water over sugary drinks or sweetened beverages.
You will typically have a follow-up appointment every 3 to 6 months, depending on your A1C. Here, you will be able to talk about your medication and how it is working for you. You should also be up to date on vaccination, have annual kidney checkups, and periodic eye exam. You should also examine your feet daily, which we will explain more about on the next slide.
This is a slide explaining foot examinations in more detail that you can pause on if you wish. The main points here are washing your feet daily with lukewarm water, drying your entire foot, including between the toes, and practicing good foot care, like trimming nails and checking feet for blisters and cuts. When you apply moisturizer, do not apply it between the toes. Use clean socks while walking, and make sure to never be barefoot, including indoors. It's also important to examine your shoes, both inside and out, and making sure they're in good condition.
In summary, you should have routine follow-ups, be up to date on vaccine, eye exams, and kidney checkups. Have daily feet inspection and logging blood sugar in a log if you need to.
Diabetes is a complex disease, but with good management, it doesn't need to take over your life. This may feel like a lot of information or even overwhelming, and that's okay. The Dawn Pharmacy team will work with you to create an individualized treatment plan and will address any questions or concerns you may have. If you have questions that were not answered in this video or need clarification on anything that was unclear, please reach out to us at your next appointment or contact us at pharmacy@dawnhealth.org. Thank you.